Hi there. Grab a cuppa, take a seat, come and meet your health coach. Brought to you by vitalhealthcoaches.com. Welcome to today's podcast episode. I am your host, Clare Sharpen, and today I'm really delighted to welcome Tracy Achieng-Ouku to the podcast. Hi, Tracy.
Hi, Claire. Nice to see you. Thank you so much for having me.
It's great that you're here. So, Tracy, let's start just by telling us a bit about yourself.
So, I'm a health coach, of course, a pharmacist by background, and I love flowers. So, besides all I do, when I go for my walks, I love flowers, and I've developed flower photography, and I just love taking pictures and enjoying, and it just makes my walk so beautiful, and I look forward to it. So, that's a bit about me.
Oh, lovely. And today is the 1st of May. So there's lots of flowers appearing. So you must be feeling particularly pleased at the moment.
Very pleased, and it's also my birthday month, so extra pleased.
Excellent. So it's interesting that you used to be a pharmacist. Or are you still a pharmacist alongside
I'm
health
still a
coaching?
pharmacist, yes.
Right. So what inspired your shift from pharmacy towards health coaching? And how would you say your pharmacy background has kind of shaped the way that you support your health coaching clients?
So what happened was back in 2020, I got ill. We didn't know what it was, but long story short, it turned out to be long COVID. So I was off sick from work for a long time. And when I went back, even though I had adjustments, it was very difficult. And then a year later, just when I thought my health was coming back to a good level, I lost a cousin of mine, and then my health went downhill, and it led me to a series of thoughts. I need to do something to change my life because my new body is not working with my requirements as a pharmacist. You're busy, you're active when you're supposed to be active, but my body just wanted me to be still. So then I decided to prayerfully and faithfully take a leap of faith and look for something else. And that led me again to a journey where I discovered health coaching. And when I discovered what it was, I discovered this is what I was actually looking for a long time, but I didn't know it existed. And so I started my training course. I loved it. And then here I am.
Amazing. Wow, what a journey.
So the way my pharmacy skills or background has shaped how I help people is, for me, I know the long-term journey of not taking care of yourself, whether intentionally or unintentionally. And so I'm able to give that side of the picture, the bigger picture, when clients may not understand the full gravity of not taking action, but I do it in a way it's not fear mongering or scaring them. It's just in a way to, first of all, get their own understanding. And then from that, fill in any gaps based on my pharmacy background. So I think that works better when you get to understand what do they know. If there's any gap, then I help them to fill that gap. And then they understand the bigger picture. And then that motivates them to take action.
Mm. So, from your own journey with long COVID, obviously, one of the things that has been really difficult for a lot of people with that is there's no medication, is there, that
Correct.
can
Yes.
resolve it. So, and many people rely heavily on medication. So, how did you navigate that yourself? How did that influence your journey? And yeah, what does that look like for you
Yeah.
as a
Now, for
pharmacist?
me, yes. And I think for long COVID, what it is it's very different for everyone. So it's not going to be one size fits all with the symptoms, because the symptoms are more than like 200 symptoms. So for me, actually, the lifestyle part is what has really helped me, so that where there is no medication, that hasn't been a problem for me. And I remember part of the long journey. I had respiratory physio, and then I couldn't see anyone on the NHS. I decided to travel back to my home country, Kenya. And the doctor said to me, if I just remain dormant, yeah, if I don't move my body will remain as it is. And so that motivated me. Okay, let me just start doing some movement to my own capacity. And as time has gone, that's what's worked for me. For some people, that may be harmful to them. So it's just a case of finding what works for you, but definitely the lifestyle cannot be neglected. Even if a medication comes up in the market, a new medication, the lifestyle, taking care of yourself, feeding yourself positive thoughts, trying your best to get quality sleep. I know that's very difficult for people with long COVID. Eating healthy, that is definitely something we can all do. So that lifestyle part becomes so essential in your recovery journey.
That's really interesting. And so many people you will have seen as a pharmacist rely on medication heavily. So how do you help clients make that change that you've obviously made towards lasting lifestyle change, especially when they felt stuck or perhaps even dependent on prescription medication?
Yes, and I think it's educating them on what lifestyle can do, because I feel maybe people understand, yes, go for a walk, but they don't understand what does that do for the body. So then again, it's understanding what do they know, and then again, filling those gaps. So example, people with type 2 diabetes, I was working with some, and even with pre-diabetic. So when they understand, because sometimes they don't understand that if you make the lifestyle choice, you can reverse it. And when you reverse it, then there's a possibility you can come off the medication. But some people don't understand that. And it feels like too good to be true. But this is one place where your lifestyle can really make that impact. So it's also understanding what do they want. So they want a quality life. They want to play with their children. They want to be free. You're not having to go for all these appointments, but it starts with you making changes to your habits, your daily habits. And then that's when you get to see results. Then that's when you get to see reversal, say in type 2 diabetes or pre-diabetes. And then you don't have to get on the medication. And it's possible.
Yeah. I remember a couple of years ago when I first, I think, heard on a podcast or read that type 2 diabetes can be reversed through nutrition and lifestyle. I was like, what? You serious?
Yes.
Kind of didn't believe it at first. And then thought, well, why is everyone on all this medication and having a really very difficult lifestyle as a result?
Yes.
And major consequences when actually it's reversible. Yeah. So it's really interesting.
Yeah. And I do have a story where there's a gentleman I know who's a diabetic ambassador, and he's lived with type 2 diabetes for 19 years, but he's managed to take care of himself lifestyle, and he hasn't had to take medication. So when you're serious, when you're willing, when you're committed, you don't have to be motivated. That's something you can get help for. But when you're committed, lifestyle can make a really big impact in your life.
Yeah. And a lot of us really underestimate the impact, don't we? We think, oh, it's something that's nice to do or we should do, but yeah, don't make those changes. So how does your understanding of medications and their side effects give your clients, your health coaching clients, kind of, I guess, an advantage in choosing a more holistic long-term approach to health?
Yeah. So even like when I onboard them, when they fill out their details, their health profile, I'll be able to identify, okay, from the medication they've listed, this is what's happening. They've got blood pressure or they've got heart problem. So then when we're having our sessions together, they may mention, oh, I'm getting fuzzy lights at night. So for me, I'll know that's a side effect of their medication. And then I'll be able to signpost them back to their doctor. If there needs to be an adjustment or a reduction, then at least they know that coming from me. Whereas if they just think, oh, this is just part of the condition, then they just keep going on with it, not knowing, no, something can be done about it. So that's really helpful for the clients I would work with. Yeah.
So if someone were to think that by pursuing health coaching, you have to stop medication, what would you say to that?
It depends, because example, say someone who has type 1 diabetes, you cannot stop your medication. At this moment in time, there's no cure and you need to take your insulin. For someone, say, on type 2 diabetes, that can be a possibility, but you must be committed to doing the lifestyle changes. And then depending on the situation, because everyone's situation will be different. So that's going to be a discussion with your doctor. and then you get an informed, you have a discussion, and then you can make that informed decision together based on what's best for you and your health in the long term, considering your family history and any other conditions you may have. So it's not something you can just say, okay, I'm stopping because I feel better. A lot of thought needs to go into it. And definitely your lifestyle is going to be a major contributor to make that even a possibility.
And then on the reverse of that, how do you help individuals who should be taking medication but don't?
This is a thing. And I think, again, it's education, because sometimes they don't understand why they're taking the medicine. So it's finding out, okay, what did the doctor say is the reason why you need to take this medication? And if they don't know, then I can help and guide them with that. Another thing, actually, when it comes to medication is there's a service at the pharmacy where when you get a new medication, the pharmacist would give you a call to see how you're doing. And if there's any side effect, anything different, you can let them know. But people don't take up this service. And so I would encourage people, if it's offered to you, take it, or just speak to your pharmacist. If there's any issue, then they can guide you. So in terms of taking medication, it's understanding what you're taking, why you're taking it, what's the long-term reason why you need to take it. And then sometimes when you put it that way, so say example for blood pressure. So sometimes your blood pressure can be perfect, but it's because you've been taking your blood pressure medication. So we need to make sure it stays that way, because if it doesn't, then your blood pressure can creep up, then risk of stroke, risk of heart attack. So we don't want that. So for some medication, you need to take it as long as you're for the rest of your life. And for some, there may be a possibility of if you take care of your lifestyle. So finding out what somebody knows, and even finding out why do they not want to take it. So somebody on blood pressure medication may say, oh, I feel okay, so why should I need to take it? But it's making them understand in your body inside, you may feel okay, but unfortunately for blood pressure, it's one of the things we don't know sometimes when it's high. And when we know when it's high, it's often very risky or too late. So we don't want that situation. So when you explain it to them in a kind, empathetic, compassionate way, and you include them, listen to any questions they have without any judgment, then okay, I'll do my best. And then we can start with that, and then we can build that through.
It's interesting, your experience being a pharmacist and then seeing a different approach to health, having had long COVID. And as health coaches, we have a more holistic approach to health than the medical profession generally does. So people who've only ever been offered a medical approach or only ever seen that approach, what do you see are some of the common mistakes or myths or misunderstandings? There's a lot of nonsense on social media. What do you see from people who, perhaps are getting a bit confused?
Okay, so maybe they just focus on the medicine side of things. Yeah, so it's like you said, we underestimate the power of lifestyle, the power of healthy eating choices. So I think when you don't have that understanding, then you really rely on the medicine and you think it's the everything, the be all and end all. So for you, so long as you're taking it, you feel, okay, I'm taking it and that's it. And I remember there was a conversation with a fellow pharmacist, and we're saying, again, in the example of type 2 diabetes, someone may feel, okay, I'm taking the medication, so I can eat my KFC, I can eat anything I want to do because I'm taking the medicine. The medicine should do everything. But no, the medicine will do its bit, but a huge chunk will always, for every medication that you're taking, will always be your lifestyle. So again, it's education, getting what they understand, getting to understand their reservations. I know, example, like for statins, the cholesterol medicines, a lot of people have had the side effects or from their friends or just, media publications, and they're scared. And so it's also reassuring them that, yes, it is scary when you hear those side effects. However, we need to balance the risk and the benefit. So if the benefit is more than the risk, then this is worth pursuing. If it changes, if that ratio changes where now you're experiencing side effects, you can't even do your day-to-day activities, then you need to look at that and adjust it. So it's reassuring them that whatever happens, we can always readjust it. This is not to say you're going to be on this medicine for life and that is it. we can always discuss as things go on.
So tell me, Tracy, who do you support? Do you have a particular specialism in your health coaching? Obviously, you're drawing on the pharmacy background as well. What sort of
Yes.
people or conditions do you specialize in supporting?
So at the moment, it evolves as the needs of people that approach me continue. So at the moment, I'm supporting entrepreneurs who are busy. They're trying to grow their business, but their health is being sacrificed. So if you're not going to be healthy, those ideas, you'll not be able to execute it, or you're just not getting the ideas because you lack sleep. So if your business is so important to you, then we need to get your health up on top so that you can enjoy all your hard work. So that's the group I'm now currently helping.
And what sort of things would you look at with someone in that kind of position?
So the key things I'm looking at for them is their eating habits, eating healthy, making sure they've got energy from what they're eating. I'm looking at their stress levels because as an entrepreneur, business person, you have the passion to drive your business, but it can be a very difficult journey. So that will be stressful. So I'm helping them with stress and also sleep. Because sometimes you're thinking, oh, I must grind, 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 and hustle, and you're up till 2 a.m. You have a meeting at 7, or you need to wake up and go for a meeting. So you're not getting quality sleep, and then it becomes a vicious cycle where you don't have energy because you're just eating anything you can because you're too busy. You're stressed up, so your cortisol levels are up, and you're wondering, oh, why am I always craving? Why am I always irritable? And in addition to that, you're not sleeping well. So that's going to add to your irritability. But when we do it in a way that fits them so that they don't feel, oh, this is another to-do list, in a way that fits them, then they start to see the impact on their own personal life and also in their business.
Yeah, great. So from the clients that you've worked with and your experience, why would you say, as a pharmacist, health coaching works?
Yeah. Health coaching works because this is a space where we're looking at you as an individual. It's not one size fits all, which sometimes in the other spaces that often happens. I know they try to their best of their ability to look at you as an individual, but here we have the space to look at your day-to-day life from when you wake up, what you're eating, your stress levels, your social connections, because that's important too for your mental health and to feel you've got that community support. So we're looking at so many things, a holistic approach. When you do it that way, then people start to see, oh, actually, the reason I'm not eating healthy is because of my environment, whether at work, we always have biscuits and donuts and things or whatever. So then you can say, okay, let me start carrying some snacks into work. And right there, you've made a change. It looks small, but it's going to be impactful. And such small changes, that's why health coaching works, because those are the things we're trying to get. And we just do them slowly, realistically. And then that way, when you get the change or when you get to your goal, yes, you've gotten to your goal, but you can now maintain it because you found your own unique formula that works for you. So if someone likes the gym, excellent. If someone doesn't like the gym, we find what works for them. And then they get excited and motivated and most of all committed because now you're looking at it, the approach you're taking is different to anything you've ever done. And that's why it's so transformative.
Yeah, amazing. So, Tracy, if someone's listening to this thinking, oh, that sounds great, I need a bit of Tracy, the health coach, in my life,
Yeah.
How do they find you?
So the best way to find me is I have a profile on Vital Health Coaches and I have different listings there. So we can initially just have a chat for me to get to understand what is going on with you. What would you like to change? And then I can let you know how I can support you. And then we can take it from there. So that's where I can be found.
Well, it's been really interesting to chat to you, Tracy, and to hear the perspective of a pharmacist come health coach, and actually how these two things aren't separate, are they necessarily? The sort of mainstream approach and prescription medication approach and health coaching approach. And actually, I think you're a really lovely example of how those things can work together to someone's greater benefit, than just one or the other on their own. So yeah, it's been really lovely to hear your story, and thank you for sharing your personal journey with us as well.
Oh, thank you so much, Claire. It's been really great to share my experience and just to share how, this space of health coaching can help people to transform their lives. Please don't think it's impossible. Wherever you are in your journey, it's so possible in your own way, and that's the beauty of it.
We hope you've enjoyed this episode. For more on how a health coach can support you in your health journey, please go to vitalhealthcoaches.com.